this is Dr. Konstantin. I'm a facial plastic surgeon and New York-based facelift expert. And I'd like to help you today to make a decision. What type of facelift would work best for you? And this decision, of course, is very important because this will determine how good your results are going to be, how happy you're going to be with your results, and how long those results are going to last. There are two basic types of facelifts that most people who specialize in facial rejuvenation procedures would do. One of them is called a SMAS facelift, and another one is called a Deep Plane Facelift. Let's look at the difference between the two. A SMAS facelift relies on pulling the muscle, and the muscle is called SMAS, submuscular poneurotic system, which is located right under the skin. And by lifting the SMAS, you can get rid of the facial sagging, the jowls, and the neck laxity. Now, the other type is called Deep Plane Facelift, and as the name implies, it goes much deeper. So it goes under the SMAS, and it releases the ligaments that hold the facial tissue together. And by releasing the ligament, it can elevate the entire face completely unrestricted. Now, why is this important? Well, because the main ligaments that hold the facial tissue together is located right here at the cheek level, right on the bone. And unless this ligament is released, only the lower part of the face can be tightened up and elevated. Now, once you release the ligament, the entire face can come up as much as it has to. That fundamental difference determines what type of facelift would work for what type of patient. During the early aging changes, mostly people have the jowls, and this is the first thing they notice. The cheeks are fairly good and there's no significant neck laxity. So the SMAS facelift works beautifully well for them. Now, once the aging changes become a little bit more advanced, you have the flatness and the sagging of the chins, you have the jowls that are a lot more severe, you have the neck laxity, you need something bigger than a SMAS facelift because you need to be lifting all that facial laxity up back where it should be. What kind of patient would benefit from a SMAS facelift? Well, those typically would be a younger group of patients, somebody in there from early 30s maybe to mid 40s with the aging changes that are not very significant. Mostly the jowls and the cheeks and the neck would be in a fairly good position, so they would not require a significant lifting. Now, somebody of the older demographic, maybe from late 40s to 60s or even 70, would require typically the procedure that is a little bit more involved. Releasing the ligaments and lifting that entire area would be necessary to achieve the best result. People often ask me, what if I get the different type of facelift that I need? If I need a deep plane and I get a mini facelift, what would happen? Or the opposite, if I need a mini facelift but I got a deep plane facelift, would it be better or worse, or what's going to happen? So let me explain. When somebody needs a mini facelift with those early aging changes, they can get a deep plane facelift and it would work very well and it would make them look younger, but it would not be significantly better than a SMAS facelift. Because their face had not descended quite as much, it does not need that big lifting, and releasing the ligament is probably not necessary in those situations. So it could be better, but if it's better, that would be better just by a tiny bit. Now, when somebody needs a deep plane facelift with people with more significant aging changes and they get a mini facelift, well, the result would not be quite as good and it would not last as long. And that's probably the biggest problem, because when people get a smaller facelift that they need, a year or two might pass by and they're going to be looking in the mirror and saying, well, I kind of look the same now, so what should I do? And at that point, they start thinking about getting a bigger facelift, which of course turns into getting 2 facial rejuvenation procedures instead of 1 to begin with. This was Dr. Konstantin, and we were talking about what type of facelift is best for you. Now that you're experts, you know there's a SMAS facelift and a deep plane facelift, and depending on where you are, whether you are in your 30s and 40s or in your 50s and 60s, and depending on the amount of aging changes, you would know which one is the best for you.